for people with disabilities. When you make your solution inclusive, it means it does not only benefit this group of people, but it benefits everyone. If it can be used by someone with a disability, it can be used by anyone. And that is why I focus specifically on creating accessible and inclusive scientific solutions.
Thank you so much, Sylvia, for that. So really recognizing inclusion of people living with disability. What does that mean to them to have safe and dignified support in that? So thank you so much for coming with that. I'll follow up with Hakeem.
Yes.
So Hakeem, tell us a little bit about your innovation and also go a little bit further and say, we know there's struggle in scaling or even starting enterprises. Tell us a little bit about your startup, but also how do you do it to ensure that you're sustainable as an entrepreneur?
Thank you so much. My name is Hakeem. I'm a final year student at the Africa Leadership University, where I'm doing a bachelor's in entrepreneurial leadership with the mission to democratize access to healthcare. Marriages is a startup I founded, I would say 2 years ago after a personal experience with malaria. If you're in the room and you've been on the continent for some time, malaria isn't something new to you. So I was doing my school internship in a remote district in Uganda. I got malaria. This wasn't the first time, but this time was unique because I had to face the harsh reality of logistic supplies of key diagnostic tools in our communities. Whereby the community healthcare workers have run out of the malaria rapid diagnostic test kits, which have been the cornerstones of diagnosing malaria in such remote communities. Because of that delayed diagnosis, I meant a delayed treatment, and it almost costed my life. This made me to reflect on how big this problem is on the continent, just to identify that more than 40% of the deaths due to malaria happen because people cannot access this malaria diagnosis. So I called upon my fellow students, looked up for professions, and we were like, we need to tackle this problem. We need to provide a solution that is tailored for the African communities to diagnose malaria. That's how we came up with Marriages, which is a reusable device that leverages on AI and biosensors to detect malaria in remote communities and also provide data on the case prevalence. So right now we are deep in our product development, but one of the key issues that we have really identified when you're a young founder in this startup world, most cases you see people going to pitch, get revenue, which is not really a sustainable measure of sustaining your business. So one of the things we have done is to leverage on partnerships early enough as we're building. So we're in conversations with people that are fronting the fight against malaria early enough. We've had conversations with people like the Charians Against Malaria. We're always in the doors of these people telling them, this is our device, this is what we're having to offer. Are you willing to buy it? So we're not asking them for like this. We're like, this is what you're designing, and we make sure that this is something that is going to change the tide against malaria. Another thing is designing with the people who we aim to use our device. So our device, it's designed for the community healthcare workers who go last mile, door to door. So in our design process, we have had interactions with them. We design, we get them in the room, they review our device, they see if it's fitting the work conditions, and we get this feedback and we go back to the drawing board and refine it. So that's how we're ensuring that after we have designed this device, it's going to, first of all, going to be bought in by the community healthcare workers and the people, but also the people who are our customers are also having this buy-in because we have engaged them in the process of developing it.
Thank you so much. Thank you so much for that, Hakeem. Partnerships at the beginning, designing, people-centric. Who are we designing for? And are they at the center of the design process? Are they co-creating and problem-solving with us? Thank you so much for providing that context. I'm going to come back to Sylvia before I go to Prof. Osur. You've spoken about really what it means to co-create for a community that typically gets left out. And this is people living with disability. And I'm just curious, from your experience, how do you continue to sustain your business so that it becomes impactful? Because it's not just the profit, It's the impact that you're creating across the communities that typically gets left out. So we just want to learn more about how do you sustain your business model.
Okay, thank you. So it's been a journey. It's been a really, really long journey. And I'll just talk about how we started till where we are now. So when I was building Sina, one of the products that we are focusing on, which is our flagship product, is a portable toilet that's safe, comfortable, and allows people with disabilities to use it independently without having to rely on their caregivers. And the vision that I had was to have a 100% locally made product. And so when we started, we quickly realized that local manufacturing is a key barrier when it comes to local production, especially of a product that's been produced before in Kenya. And so we did four MVPs that all failed. And then we got to a point where we asked ourselves, what's more important? Is it having a product that I can say this is 100% locally manufactured, or is it having a product that gets into market and starts having the impact that it needs? And so we went a different route and did 50% outsourcing of our production and 50% local production. And the outsourcing, we had to ship part of the products from China, get it to the market. However, now the cost of that was very high. And then we quickly learned again, affordability is such a big issue because the people we are serving, a lot of them don't have jobs, a lot of them rely on their families. We were able to commercialize it and impact a few households, resorts, schools, special schools. And then where we are right now, we've now gone back to doing local production again. So the vision didn't die, it was just on pause. And so now we've really changed our model. So our model initially was just the product to make the other bit of it at our workshop, and then we just sell it directly to the customers. But then last year we went to work in Western counties in collaboration with a project that's called the Western Kenya Sanitation Project. And based on feedback, we learned that people in the rural areas want us to partner with local artisans. They told us the price. So our product used to go for 35,000 Kenya shillings. And the price that people are willing to pay for is 10,000 Kenya shillings. So that's a third of the price that we're offering our solution at. And so now we are changing our model into a kit-based model where we partner with local artisans. We ship prefabricated modular parts. The artisans assemble the parts and they take them to the users. We're looking at getting our cost down to 10,000. Then also one of the things we learned from market research is there's a need for a tool to allow caregivers to transfer their patients, their loved ones, onto the toilets. And so we've been able now to come up with a second product, which is a bed positioning pad. So in the process of talking to customers and getting something that they can be able to pay, we've been able to now pivot and also introduce a new product in the market just to ensure that in the long run we're able to be sustainable as a business and not just rely on donor funding and grants in our business, and also to continue making an impact in the lives of the people that need it the most, as opposed to having something that's very expensive, but at the core, the people that need it the most are not able to afford it.
Yeah. Thank you so much, Sylvia, for sharing that. Pivoting, market research, data, and also looking, what are we trying to solve in the long term? Is it creating impact? So really you're bringing in the concept of shifting and understanding where you're delivering that program. I'll pick up on that and come to Aaron. Aaron, you are the founder of Damusasa. So I'm just curious, as a young entrepreneur, what Sylvia was speaking about affordability and scalability, what steps should young entrepreneurs take to attract investment beyond early stage support? And share a little bit about your venture.
All right. Thank you. My name is Aaron Ogunde. I am the co-founder of Damusasa, which is now an organization known as GG Health. And I'll tell you a bit about that. I work with an amazing team of software engineers. And our work literally is to make sure that patients, especially mothers and children, get access to safe blood products in a timely manner. And we work with different partners. These are what we call the last mile deliveries. And this is working with motorcycles and other couriers to ensure that the blood can move from one hospital or one blood bank to the next. So On the side as well, apart from being an entrepreneur, I am an author, 2 times published, and part of my work writing is bringing lessons, active lessons from the field of entrepreneurship and getting them to other founders and aspiring entrepreneurs just to tell them how things are, the mistakes that we've made, and what they shouldn't do and what they should instead focus on doing. Now, in terms of building a sustainable business and some of the steps that we've taken, I'd like to take you a bit back to the COVID time, 2020, 2021. And I think even before then, it was very hard to raise money or capital as a healthcare entrepreneur. But then come COVID and suddenly there's a crisis in the entire globe. And it became all of a sudden very easy to raise capital as an entrepreneur. I've spoken to some friends and actually it was like some people even raised money without the investors even looking or questioning their financial models. But then you realize that a few years after COVID now, that money dried up. And I think I saw a report the other day where in 2024, we're about 70% down in terms of the funding that was raised, about 23% down, 24% down in terms of the deal count. And just to put it into perspective, we're looking at 2021, where about 300 companies raised collectively close to $30 billion for healthcare startups. And then come to 2024 after COVID, we're looking at not even half, it's a quarter. So half of those companies raised collectively about $8 billion. So it's meaning that people took their money and took it back to fintech and those other areas, which means that to build sustainability as healthcare entrepreneurs, we really need to look at what Sylvia said, the aspect of the business model. And I think based on my experience is that if the business model works, then the impact can be sustained or the impact will follow. So what we've done at GG Health, and which one of our products is Ramus Asa, is as much as we're focused on making sure that blood gets to the patient on time, it's looking at how do hospitals pay for that, or how does the healthcare ecosystem pay for that, so that then the sustainability is there. Because as we were starting, it was during the COVID time, and the focus was at that time to just make sure that the solution is working, getting blood to the patients. But then post-COVID, we started having challenges of how do we sustain this, because then money was not easy to come by from investors and grant opportunities. So we then started now building an entire business model. And again, it's another challenge that we have in the African ecosystem where it's too much to some. When you ask them to pay later, then you have a very difficult conversation. So part of the things I write about is that even as you begin, it should never be free. This is you're providing to your customers, so that there's never that question of this used to be free, now you're asking me to pay. And again, I always say, if you believe in what you're doing and you believe that it can provide worthwhile value to your customers, then there's no need of providing it or giving that service for free, which is a mistake that the healthcare entrepreneurs I see, and I've made it and other people make it as well. So that's something to reflect on and think about.
Wonderful. Thank you so much, Aaron, for that. Really speaking about what is the business model that you are co-creating. Do we have young people in this room who have any type of business in any sector? Do we have? Young adjacent? Young adjacent? Wonderful. So we all understand, of course, funding is very critical, but also the business model, the sustainability of it. You've spoken about you do not build a business that is free, and then 5 years later, you come and tell Jacqueline, I want $5 from you. I would be like, but you gave me at zero. Why are you asking me for $5 now? So it's quite for partners in this room, and particularly who are supporting young people to build ventures. When you're providing the coaching and the mentorship and all the BDS service, to really look at the context in which our people are coming from and say, is this business going to be sustainable once we exit the market? So I will shift a little bit and we go to higher education institutions. As we recognize, the Africa Health Collaborative has 9 institutions delivering programs ranging from PhD, masters, observership, and fellowships. We have seed funding for our young people. We have policy dialogue. We have webinar series, and that cannot be done without our higher education institutions, but also the leadership of those institutions. So I have Professor Wilfred here. Professor Wilfred is a scientist, and I would like to come to him. On this panelist, we've heard our young people who have tech ventures from Damusasa to Maritest and also to Inclusion. But for a long time, higher education institutions have always been about the supply side, the training and training and training, and then transition becomes difficult. By show of hands, how many of us did get our first-time job once we graduated within 3 months? 6 months? 1 year?
Yeah, you created your.
Maybe shifted to another career that you studied? I'm an economist, but here I'm speaking about health. So you never know where life is going to take you. So I'm going to come to Professor Wilfred. So we are seeing higher education institutions really training and overtraining of our young people. We're really curious for all of us in this room to think about how should African institutions equip young professionals with the skill needed for the future workplace, or even the current workplace where technology is quite important. Professor, to you.
Thank you. Let me start by recognizing the support that we're getting through the collaborative from the Mastercard Foundation, but also the 9 other institutions that are part of the collaborative. Now, regarding the training, the kinds of skills that young people need, I think things are changing in certain important ways, and we need to train young people to adapt. First of all, in the past, I think knowledge, the premium on knowledge and knowing something, was more important than it is now and than it will be in the future. And the reason for that is the development of AI, which can make available to you large amounts of information and extract from that information knowledge, insights, that can support decision-making. Now, the tools are not yet as accurate, as reliable as they need to be, but this will change, and it will change continuously over the next few years. So that's one. You don't need to know to keep in your head to consult a book whenever you need to say if you're a doctor to do a diagnosis, you don't understand a particular patient presents with certain symptoms, you want to understand what could be the cause, you don't always need to access a book, you would have technology to assist you, drawing upon vast amounts of data to tell you what you want to know. The second thing is intelligence, right? So really, this is about how you use information. And even that is going to become more accessible to more people. So in that kind of world, what do you need? How do you train people to thrive? So I think really knowing how to use information, knowing how to connect different pieces of information is going to be increasingly important. Also, these tools that I'm talking about, they don't have empathy. They don't have an embodiment that allows them to engage with reality the way we do. So that social aspect of our engagement also will be very important. So our students will need to learn to use technology, but also the social sciences, I think, will become increasingly important. Now, what are we doing within the Health Collaborative? At the African Institute for Mathematical Sciences, we're training students, preparing them for this future by making sure they become critical thinkers and problem solvers. But we're also training them to speak the language of this technology, which is mathematics. So to become fluent speakers of that language. And why is that important? It's important because so far we're talking about technology that's mostly built elsewhere. So the foundations are built somewhere else. And in Africa, we're mostly involved in adapting these to specific uses, but that's not good enough. If we want to be in control of this technology, the direction it's taking, we need young people understand the foundations and can build technology that is adapted to African realities. So that's what we're working to do. In terms of making sure that the people we train can transition to employment. So here we're talking about being able to use a technology that's really opening lots of opportunities for entrepreneurship. But also for employment, we're working to ensure that the students we train can be absorbed into the workplace. And we're taking a number of steps, again, within the context of the Health Collaborative. We are doing needs assessments. So if you're going to train students, make sure there's a need, make sure you are training them, you're equipping them with skills that are useful. So we've done that as part of the design of a program that we're delivering through the collaborative. But also engaging the practitioners in the training of the students. So when the students they do theory at AIMS, we make sure they get exposure to the work environment. And so we partner with the future employers to provide students with these opportunities. So we hope that through these different interventions, we're going to train young people who are going to create jobs by using technology to build provide solutions to the problems, including the kinds of solutions that we've heard from co-panelists, but also young people who can fit into the workplace.
Professor Wilfred has really shared how institution can leverage technology, right? AI. But in that, there's a social aspect that you miss when you use technology is I see you, you see me, which remains critical for our higher education institutions to continue to letting young people know that that is quite critical. You're designing the new programs that's responding to the current crisis. You have to have the data to back it, the needs assessment. And are you designing for the young people market? Is it demand driven? So I'll pass it to Professor Joachim Osur from AMREF International University. Same question. But in that, I would want you to speak to our members here. I know we have a lot of partners in this room to share a little bit of, well, we're training young people at AMREF International University. What is your role at the Africa Health Collaborative? What are the type of programs you're currently implementing? And how are you thinking the role of transition so that it becomes smoother for young people once they graduate?
Yeah, thank you. So it's a very complex question. Maybe I start with AMREF International University, which is a specialized health training institution of higher learning. We offer degrees in health courses. And a lot of them are also virtual because we train people who are already in the field and that they need to update their skills. But we also do have the traditional in-campus training for fresh out of school graduates. Now, transitioning to the job market is a very complex thing. And we don't just train, technicians who go to work. There is that old thinking that I'm being trained as a nurse, so I come out and do nursing. I think the world has moved away from that. Or I'm being trained as a doctor, so I come out and be a doctor. The world has moved out of that. Where we are now, if you are a graduate, you should be able, if you are a doctor, to navigate a world where doctors don't exist and be able to create impact and be able to create livelihoods for yourself and be able to change the way things happen for humanity. And so it's a very complex question, how you come in to train as a doctor or a nurse or a physiotherapist and then end up in a world where you can create change without necessarily practicing the small thing that you learned in school. Now, what we have learned is most people come to a university. There are three reasons why they come in. One, it could be that they have a passion for the course they want to do. But secondly, it could be that they are good at what they want to do. Third is that they want to navigate this livelihood issue. Of course, the fourth one, which rarely people think about, is the impact they want to create for humanity. A training institution should be able to align all these four things to have someone who comes out and they are able, one, to practice their passion, secondly, to do what they are good at, third, to make money. It is important. You've heard, for you to create impact, you need to know how to make and manage money, and fourth, create impact for humanity. So I want to use an example to explain these concepts. A real life example of one of the students that I know who was very good at maths. Those people who are really good at maths. So she was called to the university to do statistics, which is very mathematical, and she went for it. She was good at it, but that was not her passion. She was a lady. Her passion was public relations. She wanted really to create impact through, PR, whatever they do there. And so she came in to do statistics, but her passion was PR. But at the same time, she of course needed money to survive and also do what she liked. She graduated as a statistician and was hired in an institution as an M&D assistant. As she was doing that, and during her training, she was attached to an institution that was doing PR. So she kept learning PR. And then after some time of doing statistics and M&E, she decided to form a company to do PR for health in Africa. As we talk now, she runs one of the big PR firms in 4 countries in Africa. She employs about 100 people. And she was telling me her portfolio, in the business is slightly over $3 million. Now, the 3 things or the 4 things again, passion. Passion was PR. What could she do well? It was maths. And is she able to make money? Yes, by forming a company and doing the PR thing. For you to have all that, you need to, the university or the institution of learning needs to recognize these needs and create opportunities that make you be able to achieve all those. And they are not easy to achieve in doing one course. Therefore, universities must be able to offer what we call micro-credentials. So I may come in primarily to do maths or statistics, but in that process, I'm able to do other small courses that may add up to what I want to do in future. But in that process, I must also learn entrepreneurship because money is important, and how you manage it and create impact using money is important. But you must also ask yourself, how does my passion, what I'm good at and making money, create change for humanity? That is the role of an institution of learning, creating that person. Now you realize that person may never be a statistician for life. because the needs are broad. And that's why you can see our colleagues here, they're not saying that I went to university, I did engineering, now I'm employed as an engineer. No, they're saying I'm looking for money to pilot this innovation, to change lives of people. That is much more than engineering. So institution of higher learning must be able, therefore, to align in all these things and produce this agile person who lives in a dynamic market and who is able to create impact for humanity. And that's what we do at AMREF. I think the Health Collaborative has been very good because it's looking at education in all those aspects. So we are looking at entrepreneurship. We are looking at what a student is good at. We are looking at innovation and how to manage enterprises. And we are looking at the employment sector and how then you fit your innovations within that sector to create change and also create employment and build enterprises.
Wonderful. Thank you so much, Professor Osur, for that. Higher education institutions should try as much as possible to incorporate the concept of Ikigai, right? What are you good at? Can you make money at? And can you do good while you're doing that work? So really wonderful. I had given the room an assignment. For those who are at the back, at the beginning, I had given the room assignment. In 10 years, what will be your contribution to the Africa's primary healthcare sector? What will be the news headline? And I want to start with our panelists, and I am going to come to Sylvia because I saw your beautiful smile. So could you share your news headline? And then I'll pass the mic to the room. And as Sylvia is coming up, I would like to see if we have any investor in the room. Do we have any investor in the room? Anybody who works in funding young people? Do we have anybody in the room? Okay, wonderful. I'll come to the room. But Sylvia, to you, what is your news headline?
Pressure. I'm feeling the pressure now going as the first person. My news headline is Cholera is Dead.
Cholera is dead. Sylvia's news headline, Cholera is dead. So I will pass it to Professor Wilfred. What is your news headline in 10 years?
That we are self-sufficient in providing healthcare to our people and supporting the world as well in that aspect.
That Africa is self-sufficient, that we have worked with our government to put budget in financing so that we can be able to tackle all our health challenges aspirationally all together. Anybody else? I'll come to Aaron, to you. What is your news headline?
I think it would be 0 deaths due to lack of blood.
0 deaths due to lack of?
Blood.
Blood. 0 deaths due to lack of blood. Cholera is dead, self-sustainable, that we've convinced our governments to have funding for health work, and then 0 death due to lack of blood. I'll come to you, Professor.
AMREF students changing Africa.
AMREF students changing Africa. I would want AMREF team to clap for that. And last, can I come to you, Akim?
Yep. It will be a paradigm shift from a reactive to a preventive healthcare system.
Paradigm shift from a reactive. We're no longer reacting. We're preventing all the healthcare challenges that we have, that we're designing from a point of preventative than reacting to it. So I'll pass the mic to the room. I know there are rovers around. So we have a question. And if you have any question for our speakers and our panelists, please, anybody with a question? Oh, first one over there at the back, a young person at the back. But before you ask your question, I would like to hear your news headline.
Hello? You can hear me?
Okay. Yes, we can hear you.
Okay. Oh, thank you. So my news headline would be 0 period poverty. And just to build on to what Professor Joachim Osur has mentioned, I think I'll be among the AMREF students who will be changing Africa with the narrative. Yeah, my name is Nancy Nyaleso from Kenya. I work with Empower Hub, and we have been privileged to work with AMREF Health Entrepreneurship Academy to create a tech-driven platform, which is the first of its kind globally, that streamlines financing, real-time tracking, and last-mile distribution of female health and hygiene products. So my question goes to the young entrepreneurs, and I wish we had investors in this room. So when you're talking about your journey of innovation, I know when you're starting out, you have very big dreams, which are capital intensive. So I'm really interested in knowing how you went about in navigating, getting enough funding to move your idea from an idea to action. And also if there is an investor or anyone else who can speak on behalf of investors. A lot of times we say we have funding for young entrepreneurs and innovations. However, if you look at the requirements, they are very restrictive. Yeah, so for example, so to speak, you find that there's an application, but they need you to have a revenue of at least minimum revenue of $100,000. So if you're starting out, definitely it kicks you out of the application. So how do we make funding more accessible, particularly for innovations, and have less stringent mechanisms? Thank you.
Wonderful. Thank you so much for that question. I'll pass it to Hakim. Hakim, how did you manage to move your enterprise from an idea to a bootstrapper?
Also, so the first things we did, we knew because we are building a medtech device, quite a new approach to diagnosing malaria. We needed to first of all have a working prototype. So my team and I bootstrapped within ourselves. We had to collect little funding, pocket change from school because we are passionate about this to build our first prototype. After this, like how the ecosystem is currently, we went into grant applications, pitching competitions that we won. And then we saw this is not a sustainable way of scaling our product. So that's when we started, how do we now leverage on partnerships so that we start early to generate revenue to sustain our impact? Because having a great idea is good, but a great idea is not a great business. You need to start thinking from the onset, how are you going to turn this idea into a business? Impact is driven by sustainability. So that's how we have on the journey.
Wonderful. Thank you. A great idea is not a great business. A great idea is not a great business. Passion. They say entrepreneurs, and particularly youth entrepreneurs, are the most loneliest people, especially at the beginning of building your ventures. But you've spoken about passion to walk the ground that when you move, everything starts coming to you. So I'll pass the mic again to the room and we'll pass it to another panelist. We have one there and then we'll come at the front.
Good morning. My name is Dr. Margaret Mutumba, and I am actually an academic entrepreneur. So I'm representing Western University in Canada, and I turned my PhD research into a startup company called MedAtlas. So I understand what you're saying, and I think as far as universities are concerned, I really liked what the professor said about teaching entrepreneurship, because we often find that people who are academics struggle to transition into a business mindset. It's completely different understanding how technology works versus scaling a business. And so what we are doing at Western University is we're partnering with academic institutions throughout East Africa to build their entrepreneurship and commercialization programs. And I think one of the biggest challenges with health technologies is there's lack of regulation. And if you need to patent your technology, it's also extremely expensive. And also we need to look at these technologies from a regional perspective. So you're building a device that's solving a malaria problem. How can we think about it addressing malaria at a regional perspective? Because one country's market is often not sufficient. And so I'm hoping that as entrepreneurs, as people who might be in policy, we can look at creating standardization for approving medical devices or approving health classes, and that we can work with academic institutions to make sure that every student that graduates understands how to be an entrepreneur or how to start a business, so that you all are creating jobs for the future. So that's my contribution. And if there's any other young entrepreneurs that would like to partner with us, we do fund. young students. And we do work with Grand Challenges Canada. I just want to plug them because they support a lot of innovation that's happening in Africa. Thank you very much.
Wonderful. Thank you for that. And I think that's a call to action, right? For partners in this room, do we have any partner in this room that does a lot of work in commercialization of research, translating research into any idea? Do we have any partner? Is there any partner who's interested in that in this room? Any partner interested in research and translating that into action? No?
We are here.
Yeah. So please, can we make that connection happen? And then young people who are looking for funding or any support, we also have a network there. Thank you so much for that contribution. And absolutely, I agree. The power of not just doing research for the sake of research, but how do we commercialize that it really creates impact, whether it's in entrepreneurship, patenting, having that IP and earning money in the process, but also creating impact, right? So any other contributions? Oh, we have one here.
Thank you. My headliner will be Africa funding US to reprogram their.
That will be the
I'm sorry, I had to put that in there. Everywhere I go, I have to mention that. Everybody's quiet about it. But mine is, so what I realized is AMREF just started training about, I think this is already in your university, about sexual reproductive health. Prof, I'm very curious. How do I make money out of that particular training you're giving under AMREF? Because I know it's in the university, you have a whole curricula on sexual reproductive health. How can I make quick bucks out of that?
Prof, to you?
Yes.
How can she make quick bucks?
Yes. Very interesting question, because as I explained, it's complex. How money gets into that equation, how impact gets into that equation, and how you also meet your passion out of it. So there are courses you do because you're passionate. I'm passionate about sexual health. I do a lot of that. And if you do it well, there will definitely be someone paying for it, for what you do. So there are those who are driven by passion, and they do it very well, and they are creating impact. And people notice that, and they use their money to enhance that. That's how I would put it. There are a lot of sexual reproductive health issues in Africa that are very difficult. So if you can solve them for people, they will want you to, use your talent, and they will pay for it. Yeah.
Yes, you can meet behind the tent and have that conversation. We are coming to an end of this session, so we sincerely apologize because we want to keep people. Hello, Prof. Ellis. We want to keep people in ensuring that we are on time. But before we do that, we really want to recognize our wonderful panelists and speakers today. So a round of applause to them. Professor Wilfred, we have Professor Osur, we have Sylvia, we have Akim, and we have Heron. So all of these are wonderful thought leaders in their space. Professor Wilfred does a lot of work in mathematical modeling and was very instrumental in Marburg and Mpox virus. So come and see him if you're thinking around mathematics and data for pandemic and epidemic preparedness. So thank you so much. In that, I will call Caroline to come and give us closing remarks. Thank you.
Thank you. Very much. I agree.
Thank you. What a wonderful session. What a wonderful way to begin the first session of the day today. I was thinking about what will I say to kind of sum up everything that has been said, because such rich conversations have been had here. And Professor Sur actually gave me the direction. He talked about a young student who was a statistics student. And it reminded me a story about another young statistics student from the University of California, Berkeley. Some of you may know this story. It's a true story about a student called George Danzig. and he was a student in University of California in the 1930s. And one day he went to class and he was late, and he found that his professor had written some sums on the board. So hurriedly, he wrote down the sums and he went off to do this assignment. And after, he thought this is really hard. And after a couple of weeks, he submitted his assignment to his professor. And then about 6 weeks later, his professor came to visit him. And why his professor came to visit him is because the sums that he had written on the board were examples of 2 sums that had not been solved by anyone. And he did not know that these sums had not been solved by anyone. He thought it was his homework. So his mindset was, how will I do this? And he went and he did his research and he tried and he tried and he submitted a paper. And when the professor got it, he of course took it through the processes, and they realized this guy has solved unsolvable problems. Yeah. And he is well known now. He's a famous professor. He passed away in 2005. And the algorithm that he solved is called the simplex algorithm. And it's used for many different things globally. You can read up on him. But that, when I was now listening to Professor and thinking about everything that has been said today, we started with the framing of what is the situation in the continent, that, you know, there are a lot of challenges that we are experiencing around the high disease burden, not enough money, not enough health workforce, no employment, high population growth, lack of financing. You can hear all these things and think, but it's impossible. Yeah. But if you begin from a mindset like some of our entrepreneurs have started with, and they think about innovation. How can we think about these same problems differently? Think about African-led. What is our context? We know our context better than anybody else. Think around people. You know, the professor talked about thinking about technology, yes, but also thinking about the people who are going to be using and interacting with that technology. How do we put them into the solution? Thinking about how do we question the assumptions that we currently have. Yeah, when we think about the headlines in 10 years, to achieve those headlines, we have to shift the assumptions that we make about what is possible, about who can do what, about where leadership begins, about the possibility of solving problems. Thinking about our own indigenous knowledge here in Africa, we solve problems in Africa, big problems every single day. We don't make big announcements about them. We don't even maybe recognize that we are solving big problems daily, but we have this knowledge that we can use to solve problems. We've talked about regulatory, we've talked about Africa, you know, we've talked about the population, but Africa, one thing about it, has the potential to be a huge market. 1.4 billion today, 2 billion in the next 20 years. That is a lot of people. That is a lot of people we can leverage to create a market for the products, for the solutions that we are developing. We've talked about addressing real problems. I think you really should see the prof. I think in other circles, maybe many of you know this. He's known as a sexologist. Yeah. That is thinking about how do we solve real problems that people have with the knowledge and the passion that we have. So I think my conclusion is a lot is possible. Yes, we live in difficult times, but we live in times of opportunity. And there's one quote that I love, and the quote is, "The opportunity of a lifetime needs to be seized in the lifetime of that opportunity." I think the Health Collaborative is giving us the opportunity of a lifetime. It is up to us to seize it. Thank you.
Thank you so much, Caroline, for that wonderful closing remarks. We also want to remind everybody in this room that we have a booth that is located close to the entrance, close to the AMREF booth. So we encourage everyone to go there and visit and learn how do we build partnerships. We have Professor Elicia from Kwame Nkrumah University of Science and Technology, They do a lot of program in community, but also in supporting young people to in PhDs and all of that. We have partners from MOI who do work in indigenous knowledge and supporting with that. So it would be wonderful if some of you would be able to go there. But thank you so much. We truly, truly appreciate. We've tried as much as possible to stay on time. So could we all clap for ourselves? Yeah. So we would encourage the team to come and take a picture. Beatrice, come and guide us. Okay. Okay, wonderful. Have a lovely day and thank you again so much. I know we are all heading towards the plenary session, so we will have members of the Africa Health Collaborative come on stage to take a picture, and also we'll have the rest of the team leave. Thank you so much, and we look forward to seeing you in our booth. I will be there, so if you want to speak, please come to our booth. Thank you.
Nice.
Thank you.
Thank you, thank you.
Oh, people here. Well, joining another day.
Could we get the members of the Africa Health Collaborative in front, please? Willie, Mika, Jacqueline, I'll start calling. Alexi, Manjula,
Hello, nice to meet you.
Joseph.
Good session.
Hello.
Alexi, Abdul. Okay. The team from Zambia and Senegal, please. I know, I was.
No, it went very well.
This was a good turnout.
Yeah, so grateful.
I was worried
because
you
early in the morning. I think we need.
I will be.
We need our row at the bottom.
Oh, people can. Yeah. Like, no.
Yeah, if you're big.
What if we sit?
The photographers should tell us, they're the professionals. They can see all of us, really? Also, they come in between two heads.
Yes.
Thank you. Thank you. That was well done, Alimni.
Thank you.
Well done. Well done. Good session.
Thank you.
Yes, no, you can congratulations. The next slide. Journalism.
Thank you. So you know, like, were you for the reading? So they saw you. Another day.